Hi, everybody. Welcome to This Week in Global Health, or TWiGH. We are coming to you today from the World Health Assembly in Geneva. It is WHA 68, and we are very excited and fortunate to have our panel, as well as a number of students from the University of Southern California Masters in Public Health program joining us today. I'm Chris Ronson. I'm coming to you from San Francisco, California. I'm going to turn it over to Dr. Terry Schmidt to begin the introductions of all of our special guests today.
Hey, Chris. So, first of all, I usually hail from Southern California, but the 6 boxes you have down below you, 5 of those boxes are sitting here in Committee Room A, the World Health Assembly in Geneva, Switzerland. Let me have each of them say hi. Let's start off with Nina.
Hi, everyone. My name is Nina Karasmi. I'm usually from Los Angeles, but like Terry just said, I'm currently in Geneva, Switzerland at the WHA.
And Evan.
Hello, I'm Evan, also visiting Geneva for the World Health Assembly, but usually a student at the University of Southern California.
Whitley.
Hi, I'm Heather Whipfley, and I am a professor at the University of Southern California, and bring the group of students here to the WHA every year.
And of course, actually sitting 3 feet from me is our usual Katie Jackson.
This seems like a really unusual live show, but yes, hi everyone, I am Katie Jackson. I'm coming to you from, I almost said Stockholm, from Geneva. I'm originally from Stockholm, Sweden. And we're really excited to have this event in this crazy, awesome room. I don't know if you guys can see that we are in the delegates room. So technically, I think Evan is in Sudan right now.
We're being truly international today, with the exception of me, again, stuck in San Francisco. So I have major fear of missing out with you guys, but we're really happy to have you here and talking to our audience today. So I suppose if anybody wants to follow along, we are live on Twitter at TWiGH Team. You can use the @TWiGH Team handle or hashtag TWiGH. You can also get us on Facebook, YouTube, or hopefully you're watching this live on our website. In the meantime, let's go ahead and get things started off. Terry, did you want to give us a little bit of insight and background into the World Health Assembly and the purpose that it serves for anyone who's a little bit new to either this discipline or to the events that take place?
I do. So I wish to tell you, first of all, Chris, I'm going to call upon Heather. Heather has organized a Twitter storm. Tell us about it, Heather.
Yeah, everyone should be tweeting as we present today. You can hashtag the TWiGH and also hashtag WHA68 so that everyone out there can follow along the conversation, and we can spread in the messages that we're learning here at WHA as far as possible. So join in on our Twitter storm.
Terrific. So let me tell you where we are. We're in Geneva, Switzerland, a neutral country where the World Health Organization is headquartered. And bear in mind, the United Nations is one of the several United Nations agencies. So this is an agency of the United Nations. There are 167 member countries. We're looking around this room at 167 different tags. And we're here to deal with global health. So we're the policy mechanism for the United Nations, thus the world. And so that's an important body of information, or deliberation here for us today, this next 10 days at the World Health Assembly.
Oh, sorry. And then I think, too, we'll turn it over to Nina to follow up. Nina, it looks like you're on. Did you have questions for Terry in regards to the assembly?
Yes, so Dr. Schmidt, for first-time assembly members, can you explain what the WHA process is and how it looks like and how it may work?
So Nina, who do you want to answer that question? Let's have Evan answer it.
Okay, so the assembly started in the Assembly Hall with an address by the Director General of the World Health Organization, Margaret Chen, and also there was an invited guest, the Chancellor of Germany, Angela Merkel. So that was really good to hear an overview of the past year in health and some of the main topics that this assembly will discuss. And then also, since then, we've really been breaking out into smaller rooms and smaller groups where panels have spoken about their topics of specialty, and there's been a lot of room for questioning the panelists and getting a good sense of the SDGs that are coming up, non-communicable diseases, all sorts of topics that range countries throughout the world.
Yeah, there's supposed to have been a huge emphasis on the Sustainable Development Goals. I know that we're coming up at the end of this calendar year to the end of the MDGs, the Millennium Development Goals. So most people are putting the emphasis on how do we move forward from here. And so I imagine that between Ebola and that, we've seen a lot of coverage of NCDs. Anything that you want to add or anything interesting that you've heard in the interim? Nope.
Nina, I know wants we're ready to respond to that. So Nina, tell us what you're thinking in this agenda that's going on.
Well, basically in regards to the SDGs and MDGs, it's been a fascinating discussion about the development of health systems and how do we coordinate all of these services, especially in regards to surveillance and monitoring of outbreaks as well as diseases. And so it's been really interesting, especially with the Ebola discussion. How do we determine ways in which we can effectively monitor future potential and current diseases, and how can we effectively treat and manage diseases in the future? And so I found it really fascinating because the discussion has been ongoing, and there isn't one solution to this issue. It's very multi-sectoral, and it requires a lot of different perspectives, and hopefully we can find a possible solution in the future.
Very much so.
Well, Chris, let me add, if I may.
Mm-hmm.
Evan and Nina have been working diligently in preparation to come to Geneva. Part of that has been working with their classmates. So let's have Evan and Nina give us an introduction, what they've done with their classmates, and what we can look forward to having on the internet at TWiGH.org.
Yeah, so before we came to Geneva, we filmed some of our classmates asking them what their expectations of the World Health Assembly were, and then once we got here, we sat down with them again to ask what their impressions were of everything they've seen so far, what sessions they've attended, and how it relates to some of the coursework that we have back home in Los Angeles. So we've just we're going to upload a video compiling these interviews with our classmates and giving a sense of the first few days of the assembly, and that should be up on YouTube shortly.
Yeah, and that will be available. Oh, sorry, Terry. That'll be available on our website too. As soon as we can get that going with the Wi-Fi there, we're going to have that available for everyone to view on our website, on Twitter, on Facebook. So definitely check that out at all of our different areas. Okay. And then, Evan, did you want to go? I know that you had a little bit of feedback and some questions about content at the WHA.
Yeah, I wanted to ask Katie and you, Chris, as well, what sessions you've attended and what has stood out to you so far in the past 3 days, and then also what we should be looking forward to towards the end of the assembly.
Okay. Well, Katie, I know Katie's there in person. I have been following the WHA on Twitter as I was.
Which is an amazing thing, by the way.
Which is amazing. And they actually, this is the first year that they've had it webcast, so you can follow along with a lot of the different plenaries and some of the side sessions.
And I would say, like, the youth representation right now, or the young people, I guess we can call it. I hate these words that denote age, but everyone is really well represented and really involved, and everyone keeps on saying when they get up at the podium, they say, tweet about it. And like, you know, we've had the executive director, Katya, from Women Deliver. She started her panel discussion with, I am going to have a tweet, a sentence, and a statement, or something along those lines. So she started and ended her discussion with a tweet, which I thought was really cool. So it's actually really cool that there are a lot of tweets going around.
Yeah, and I know I don't feel left out because there's been so much coverage from so many different sources that you really do feel like you're there. I am going to turn it over to Katie because she's got the on-the-ground experience and can give you guys a little more insight into the discussions that have been had and a lot of the points that have been made by the guests and speakers at the WHA.
Yeah.
So go ahead, Katie.
Okay, so one of the really interesting things that got announced today was the budget for the WHO. And what the interesting thing is that it actually was the exact same as last year. Now, the question that's now being asked by the public is, okay, so the WHO budget is the same. What does that mean for Ebola? What does that, like, have we not learned anything? What does that mean for, resources saved and put to the side? So what this does mean is that the country budgets are staying the same, like the delegations, plus there's a voluntary amount that can go in there as well. So what that looks like is happening is the WHO is going to keep everyone at the same budget, work with that, and then perhaps create something, a little project on the same side with this reserve idea of building up money and resources for disasters. Now, this is really interesting, coming right on the heels of the Nepal earthquake.
Mm-hmm.
And I was in a session today about the earthquake in Nepal, and actually they had said it could have been worse because Nepal actually has done a lot of work over the years working with disaster relief and preparedness, that it could have been a lot worse. And so this idea that, you have to work at preparedness all the time, it's kind of going, people are saying, is that in line with the WHO budget? So interesting. Another subject that's come up a lot, climate change. There is a resolution that the International Federation of Medical Students Association is trying to press and have a decision on to take this up and make a better commitment to climate health. There's been a lot around access to medicines, really great MSF access campaign event today, a lot of side events going on about delinkage. So the idea that drugs are really expensive because the research and development are in them and they're linked to the price of the drug. So if the price of the drug is not going to be high, they're not going to research it and put money into the development. So this idea that you should delink these things so that they exist on their own and are able to put enough research and development into the drugs we need, even if they're not necessarily going to be expensive.
Okay.
Hey, let me jump in because I want to actually ask Heather, and I really want to ask her how many countries she's been in. I do know that she's been leading these students here at the WHO for a number of years, and this afternoon she shared with me her blog, which is going to occur at the Johns Hopkins Global Health Now. She had some wonderful insights to share with us on what's going on at WHA and also student involvement. Share with us, Heather.
Sure. Yeah, I've been bringing students for the past 4 years, and there is a real difference this year, I think, in the spirit of the kind of atmosphere in the Palais. There's, I guess, a more tension in the response to the Ebola outbreak. Ebola is a huge issue this year, and whether or not WHO has learned from those lessons, whether countries have learned from those lessons, or whether we're bound to repeat it. And so that's been an interesting kind of additional emphasis and kind of importance of what we are here about, why we're here and what are we really working for. There's some real relevance this year that maybe hasn't been there in the past. And WHA is so overwhelming for first-time attendees. There are so many events happening, there are so many different delegations and issues at stake, and so it can be a little overwhelming. And I decided a few years ago that, when we come in as a public health experts, we have no idea how to handle this environment, this international diplomacy, and that we really needed to integrate this experience into our public health training. And so that's really my goal, is to get students to come here to see what it's like, so that when they go out into the world and they're working for the organizations, the NGOs, the governments, in a few years, they're really prepared to come here and contribute from the start and know how to prepare their delegations in order to have the biggest impact in progressing public health. So that's why we're here, and I think this year is just a perfect example of showing how fast things are changing. WHO tomorrow is not going to be the WHO of last year, and the students here really are seeing that transformation happen, and they're able to take those lessons back with them. And as an educator, I know I can't just teach facts and figures. I'm teaching them to think strategically and critically about these key issues that are really being highlighted at this year's WHA.
That's a fantastic approach, Heather, and I'm so glad that that's something that you've integrated into your teaching in your course, because there's almost nothing more important than that real-life experience. And I think the events of the last year especially, everybody knows about the WHO sort of very peripherally. If you're not in the global health world, if you don't work in it, if you don't have an internship in it, if you're not doing something along those lines, then most people don't really understand how it works and what it offers to the global community. And again, the last year and a half has really brought it front and center just what an instrumental resource they are as a governing body, and that's why we're trying to go through the reform. I think that being here gives people the opportunity to really see how that works from the inside out, and there's so much to learn. Like you said, it can be a little bit overwhelming, but you sort of have to get past that and engage yourself and get comfortable with it, because that is global health at its truest. To go back really quickly to what Katie was saying as well, I was actually following Judith Rios, who is She is one of the directors for the MSF Access campaign domestically for their R&D and intellectual property stuff. She came on one of our shows, one of our previous TWiGHs when we did our Access to Medicine series. And so she was tweeting about what Katie was mentioning about sort of separating the research, the development, the cost, and getting everything unentangled to allow for greater or increased access to medicines and things along those lines, which I think is a very interesting topic. I also know that universities allied for essential medicines are there, the IFMSA is there, the International Federation for Students of the Medical Association, and they're representing and talking about access to medicines a lot too. Now, those are the things that I found interesting, and I think it'd be really interesting to hear what the expectations and the overall experience is like from a student's perspective. So I want to direct it back to Nina and Evan. What are your first impressions of the World Health Assembly? Is this your first time here? What do you think? Is this a useful experience to you? As Dr. Whipfley was saying, you know, trying to get everyone integrated into it.
Yeah, so this has been my first time attending the World Health Assembly, and it has been extremely exciting. Overwhelming is definitely one way to describe it. However, you kind of get used to the flow of things after the first long day. And it's been really inspiring to see how different people and cultures can come together and come to basically just have this discussion. And I think that was really important in one of the sessions that I attended yesterday on drug policy, was the issue of opening up dialogues, even though there are various groups which may have very contradictory positions and views, and basically creating a space to just open up dialogue with the public and with one another. And so it's been very exciting and very informative, and I definitely think if I hadn't attended this and I were pursuing a career in this field in the future, then it would have been a disadvantage, because there's no way to prepare yourself without going head first.
Yeah, definitely. And I just wanted to jump in there. I think that overwhelming is such a good word. Like, this is my first time at the World Health Assembly, and I was speaking to some other students and friends, and they were saying, like, you know, we've been to other conferences, but this is really where the power is. So, I mean, we're not walking amongst, you know, heads of universities. We're walking amongst, like, you know, country delegations. There are princesses that are here. There are people that go back home and run the health industry. I shook hands with the Minister of Health of Nepal today. Like, these are incredibly important people. Policy is just so happening right now in these halls. And the people you walk by, you don't even know, like, that they are, you know, so important in their field or so important in their home country. So very, very interesting. I know Heather has a few more comments of things that are going on right now.
Yeah, I just wanted to pick up on that. I think one of the things that's so interesting to learn is that, you know, very little actually is happening in the room that we're sitting in now. There's a lot of prepared statements, and there's important give and take, but so much of it is happening in the coffee shop. And so we spend so much time out in the Serpentine Lounge watching everyone interact, and that's really a great experience. And today, out in the coffee shop, our students had the opportunity to talk to lots of different ministers and representatives of pharmaceuticals and also NGOs. One person they met with today was Doug Webb from the United Nations Development Program, and he was really talking about how important it is, as we're sitting in the room listening to these statements, to get through the rhetoric. And I think there's been a lot of discussion, and even the Director General made a joke yesterday about how she had just spoken for 5 minutes and hadn't said a blessed thing, and how it's so much of what we're saying is rhetoric, and you have to read through the lines of what everyone's saying to really understand the politics that are happening in the room. And I think that that's just such, again, another important lesson that we have to learn, and coming from a public health perspective, we're not always thinking about all the political issues at stake.
Yeah, it's important to realize that there is that really intimate connection between the policy, the politics, the actual actions, people out in the field, that everything is very interrelated, and this is the perfect opportunity for people to view and experience that. And again, if you can't make it in person, you might not be able to shake somebody's hand, but you can watch their live stream and get a taste of what goes on and what the dialogue is like. Evan, I'm actually going to direct it back to you. What are your impressions? How do you feel about this being your first time at the WHA, and what do you think you'll take away from it?
Yeah, it's really exciting to be here, and it seems like an especially exciting time because there's a sense that this is a major period of transition for the WHO and the health community throughout the world, because with finalizing the Sustainable Development Goals in just a few months and coming out of the Ebola crisis and 2 earthquakes in Nepal, I think everyone's re-examining how great the need is to invest in health systems that have been ignored in the past. Also, with the epidemiological transition towards non-communicable diseases, everyone's talking about how we can convince other sectors of government and society that it's worth investing in NCD treatment and prevention because it'll pay off economically and through health in the future. So there's a lot going on, and it seems like it's all going to be really significant in the next few decades. So it's really been exciting to be here.
That's fantastic.
I wanted to jump in really quick on that because I think Evan mentioned something really important, which was a discussion around NCDs that's happening. Obviously, NCDs has been a big issue over the last couple of years and has kind of fallen a little bit to the back of the agenda this year with everything happening, obviously, around Ebola and communicable diseases. But one of the things you mentioned earlier was what discussion is there going on around the SDGs, and there's actually been so many side events around the SDGs, and lots of those have focused on non-communicable disease. And just because it touches so much on what Evan was saying, which is that cross-sectoral collaboration that is so important, and we need that in all areas, but especially around NCDs, and how we can use the SDG process as a way of leveraging that collaboration and hopefully getting some more resources in which to tackle NCDs.
Mm-hmm. I think that's been on everyone's radar lately because we've been talking about that transition to a lot of less developed countries having the double burden. And so when we talk about how the budget hasn't changed, but how there's all these things we need to do, and NCDs are one of the key players, it really sort of makes you think a little bit critically about what the next step is. Are we supposed to reallocate? Are we shifting focus away from something else? I know groups like NCD Alliance, NCD Free, YP, CDN are really bringing this to the forefront and advocating for it on a very large scale. So now I wanted to jump back again to Nina and Evan, just to ask you guys really quickly, what made you both interested in public health and pursuing it as a career? Has this reinforced those initial feelings for you? We have a lot of viewers out there who are MPH or bachelor's or even PhD students who are in this same field. So it might be interesting to hear your perspective.
Yeah, I became interested in extreme poverty and development through service trips in high school and reading books like The End of Poverty by Jeffrey Sachs, and then decided when I got to college to approach it through the health sector. And that's definitely been reaffirmed. Yesterday, I heard the Minister of Health from Botswana saying, she said that accomplishments in the health ministry are accomplishments for all ministries because of the impacts that progress in health has in all their sectors of government and society. So I'm definitely excited that I chose the health path and excited for what it's going to look like in the future.
Awesome. Nina, how about you? Oh, you're on mute.
Sorry.
It happens at least once a show to one of us. Doesn't matter how many of these we do.
All right. Well, I'm happy to be the first person. So I've always been interested in health. I actually was pre-med in my undergraduate curriculum. And as I was doing research on stress, ironically, I realized that I wanted to ultimately be able to make a larger population-based impact. And that's when I started to read and learn about the field of public health, because I feel like to the general public, not many people fully understand what it is, and it's such a fascinating and great field. And as I've been pursuing my master's degree and being exposed to all of these amazing events and these environments where you get to truly see sort of the people under the covers doing all these great things that they're not truly, like I said, not many people are aware about it in the public, and it's just so fascinating. And if anything, this experience has just motivated me to pursue my PhD, which I already am planning on doing, and just further my career in public health in the future.
That's fantastic. Good to hear. I'm glad the WHO is having all these excellent outcomes for everybody. It seems like it's going to be a really valuable experience. On that note, so Terry, I'm actually going to turn it over to you because I know that you have a couple of questions for Dr. Whitley in terms of her projects and maybe some advice that she has for our students and young professionals too.
I sure do, Chris. So first of all, Heather, tell us about your path on your journey, one, on global health, but second of all, tell us about this journey as a professor. And I do have to tell you, share with everybody, you may not share this, I hope I don't embarrass you, but your spouse is actually from Switzerland.
Yeah, so I really got started in global health through my internship. And I got an internship just at an undergrad at the World Health Organization, and it was an inspirational, motivating experience. But more importantly, it was a networking experience. I met so many people who have just stayed with me and helped me through my career. And I could never, it was just the cutting edge thing that just made everything possible for me in the start. And so that's been something as a professor I've really wanted to give back or make sure that others know that. So this summer we have 12 students here at the World Health Assembly. 9 are staying on and doing internships here in Geneva this summer. I think 7 of them will be in WHO. So that's a very exciting thing for those students. And I think that as advice to other students, I think that opportunity to get practical experience, whether it's here in Geneva or in country or even in communities, wherever you're going to school, that's just really critical and important. And networking, meet people. These people need to be your friends. I think that's one thing you also learn at the WHA is so much happens at receptions. You need to really make personal relationships and get to know people. So that's a really important thing. And that's what I've kind of learned and wanted to do as a professor as well, as communicate those lessons. I might say one other thing, I got my start at WHO, and I stayed at WHO for a number of years before moving on to academia, and I learned the process, and that's one of the things. I know how to get into the WHA, and one of the ways is to get students onto delegations, and so we're very lucky that the NCD Alliance has taken the USC students for the last 4 years and integrated them onto delegations, and they do various activities for them. They document the proceedings, they meet with delegates and collect information, intel, shall we say. They help with side events. They do all kinds of things for that delegation, and so it's a really win-win situation for them. And so that's one way, but you don't have to do that. Students and anyone, the public, can come to the WHA. They can go through the process of getting in and through to the building of the Palais, or you can also, watch live casting, and I think that that's a really important thing to do, to get engaged and know what's happening.
Definitely.
Yeah, that's so true. I was holding up my badge. I have a public pass, so I'm actually not here with any delegation. Oh, I'm here with TWiGH. So I just, you line up in the morning with a bunch of other people. You fill out a form. They take a photo of you, and then you're totally allowed in for the day. And they give up to 100 public passes. And what it's supposed to do is it's supposed to encourage the public to take part of this. You can then sit in all these decisions, and it's really kind of opening it up to everybody, which I think is a really great sentiment. I also wanted to mention, Heather, you touched upon networking, and I love encouraging networking at any point possible. So what I want to just let everybody know about is that we started this new campaign called Women in Global Health Leadership. And when it's a campaign to ask for more leadership in global health positions of leadership and of power. So when you go to these conferences, there's a lot of women walking around, and then when you sit on a panel, less women. And so we're just kind of trying to highlight the gap between this and reduce the barriers so that we have a more equal representation in the global health sector. And so that's a campaign for everyone to watch out for. And that is inspired by some of the great leaders we've seen here, just phenomenal women in power, and we just want to see that more often.
Absolutely. So keep an eye out for that, WGH, Women in Global Health. On that note, I'm going to go ahead, and this is going to mark the end of the archive section of our episode for you. We're going to stay live, so please hang out for the discussion. We're going to talk about policy. We're going to ask a few more questions of our USC MPH students who are joining us. And then any other questions that we have coming from the audience, comments, if you're here, let us know. Again, we've got a podcast. We've got our TWiGH website. You can follow us at TWiGH Team, TWiGH TEAM. That's on Twitter. That's also on Instagram. We have our individual Twitter handles down here at the bottom. Send us something with hashtag TWiGH. You can also get us at hello@twigh.org, TWiGH.org. So on that note, I'm going to say goodbye to everybody, but not really, because we're going to continue the discussion in just a moment. Everybody have an awesome day.